Hi, everybody. My name is Elizabeth Cox, and today I'll be presenting a poster entitled, Can Patients Safely Undergo Short Interval Free Autologous Breast Reconstruction, or SIBT, after adjuvant radiation? So as we all know, post-mastectomy radiation, or PMRT, is important in the treatment of breast cancer, and the timing of reconstruction after radiation is variable. There are three schools of thought when it comes to timing of reconstruction, and that's delayed immediate, and immediate reconstruction with radiation to the flap. The rationale for delayed reconstruction is to avoid radiation damage to the flap, which can lead to volume loss, fat necrosis, and fibrosis. More recently, others have advocated for delayed immediate in order to avoid loss of the skin envelope, performing autologous reconstruction 6 to 9 months after, but this introduces TE-related complications which are known to be higher in the setting of radiation. Finally, some advocate for immediate in order to avoid TE-related complications, but this deals with the above-mentioned radiation effects. MD Anderson published data from the SAPPHIRE randomized control trial showing no increase in complication rates between patients who underwent radiation followed by mastectomy with immediate breast reconstruction within 1 month. However, no one has yet investigated the safety of performing free flap breast reconstruction shortly after radiation in the adjuvant setting. So in order to address the aforementioned shortcomings, we looked at patients who underwent short interval autologous breast reconstruction, or SIBT, within a 2 to 4 week interval after PMRT in order to evaluate its feasibility and its safety. In terms of the methods, this was a retrospective case series where women who underwent PMRT followed by autologous breast reconstruction within 2 to 5 weeks were studied. The primary outcome was complete autologous flap loss, and secondary outcomes included intraoperative evaluation for fibrosis of the IM vessels, any postoperative complications, and breast Q scoring. Table 1 detailed our participant demographics with a median age of 48, median BMI of 24, and a median time from completion of radiation to flap reconstruction of 19 days. In terms of our results, no IM vessel fibrosis is noted during intraoperative evaluation. There were no postoperative complications, and patients had favorable average breast Q scores. These ranged from 0 to 100, with higher numbers indicating more favorable results. So Figure 1 details our cases. Case 1 was a 41-year-old female with BRCA2 mutation and left ILC who underwent bilateral nipple-sparing mastectomy with TE placement. Her final photos were taken 1 year from reconstruction and 4.5 months from revision. Case 2 was a 42-year-old female with left breast IDC, status post left nipple-sparing mastectomy and right mastopexy with immediate left TE, followed by radiation, and then autologous reconstruction 2.5 weeks after radiation. And the final photo is her 3 months after autologous reconstruction prior to any revisions. Case 3 was a 68-year-old female with left breast IDC and a history of right breast IDC and right simple mastectomy, who underwent left simple sparing mastectomy and bilateral TE placement. The final photo was 4 months from reconstruction. And finally, case 4 was a 54-year-old female with right breast IDC, status post right simple mastectomy. There was initial concern that patient had inflammatory breast cancer, so she did not undergo TE placement at the time of mastectomy. The patient then underwent autologous reconstruction with contralateral breast reduction 2 weeks after radiation, and here are her photos 3 months from reconstruction. So there were some limitations in our study, including no control groups, limited sample size, and heterogeneity in the reconstruction. But to conclude, we found in our case series that SIBT after PMRT appears to be safe, it expedites the reconstructive process, and there were acceptable aesthetic outcomes. And a randomized control trial is currently in the works. Thank you.